question here from, I'm just going to bring Melissa Oldham in, who I believe is on continent number 1. There we go.
Thanks. I just firstly, thanks for everyone for sharing so much of your own personal experience as well. I think it's so important and so interesting to hear that side of things, which is kind of academic side, so you don't hear quite as much of that usually. It's all kind of more at a distance. I suppose I just kind of wanted to follow up on what James said in terms of the cutting down side of things. I think that can be really helpful for people who wouldn't necessarily identify themselves as having a problem, but who do drink quite heavily. Because I think one of the issues with abstinence and getting to the point of saying, I'm not going to drink at all, almost takes that thought process of identifying yourself as being a part of a group, however you define that, whether you define it as an alcoholic, whether you define it as a problem drinker. And a lot of people don't want to be in that group and will put that off. So I think actually promoting kind of moderation, and it's something really interesting that Adrian Childs has talked a lot about, and I know James has spoken to him as part of the podcast as well. He kind of said that actually for him, stopping drinking wasn't an option. He never wanted to stop drinking, but he recognised that he was drinking an incredible amount. So kind of that moderation for him was a successful way of doing it. And I think as James said, you know, the people who you're seeing, you are a lot better qualified than me to make that judgment, and I completely agree that they probably aren't cases for moderation. But I think if we think in terms of a whole spectrum, it's about tailoring for different people what fits their kind of idea of their own drinking and what fits their own process. And I think the movement towards that kind of more tailored approach and more moderation for me is a positive thing, because it might actually reach people and engage people before it gets to the point of seeking out the groups and the abstinence, which at that point would be more necessary.
Can I just push back, as they say these days, on one of those? If we just accept what people's own perception of their own, behaviour is, and sort of work to that, is there not a danger that in some ways you kind of you might miss an opportunity to actually give, some helpful and clear advice by saying, deny. To not using any specific labels, but by not, for instance, labeling it a problem, then it means that people will never actually, make a clear decision.
Well, I think that there are ways of being clear and having clear goals and clear guidelines without saying I'm an alcoholic and I don't need to drink. I personally don't really agree with this kind of binary model of problem or non-problem drinkers, or alcoholics or non-alcoholics. I think people consume alcohol on a spectrum, and it goes back even to what Janet was saying. Someone who attended her group because for her, what she was drinking, half a bottle of wine, was a problem. Other people would look at that and say it isn't. So it works both ways. And I think actually, ultimately, it comes down to what's a problem for that person. Whenever you kind of look at the DSM and the criteria for kind of those conditions, a lot of the time, one of the criteria is it negatively impacting on your life? And I think that's the thing with drinking, that point is different for so many people. So I think it does have to come down to the person's perspective to some extent.
Yeah, no, point taken. I think also the fact that James stopped drinking for a period of time and then started drinking moderately shows that there's not even a binary between those things we're kind of treating as opposites. They're actually part of a spectrum of their own. James has his hand up digitally, which is very clever.
Oh, it's easy.
I was just going to follow on from that last point that, from a public health perspective, anybody who consumes, or from certainly a physiological health perspective, anybody who consumes alcohol, even at the very lowest levels, could benefit in terms of physical health from reducing their consumption. The evidence is that the overall effect of mortality is a dose effect response. So the more you drink, the more the risk there is. So, it is in a way arbitrary or highly subjective to say, oh, there's a point at which we need to define problematic drinking and then decide, do those people need abstinence or moderation? There's so many different angles to come at this from. And just from a public health perspective, any reduction in a person's alcohol use has physiological health benefits. Now, David Spiegelhalter famously said when the guidelines were reviewed, and there was all this criticism and then subsequent evidence showing there's no safe level of drinking. David Spiegel said, well, there's no safe level of driving, but we don't recommend no one drives. Or similarly, there's no safe level of living because everything carries a risk, but we don't recommend abstention from living. So I think, yeah, the really important point here is, not to just become a bit, telescopically focused on people with clinical or severe dependency, and then there is still a legitimate debate about who should deserve or kind of should aim for abstinence or moderation, and that's complex, and that should be for the person and the practitioner to work through because it is so complex. But just this broader public health perspective, that's my issue with the binary or the alcoholism model, is that it spills over, that our discussions and our media and our TV shows, automatically frame alcohol problems in that kind of, is it a problem? Do they need abstinence? Versus, is it absolutely fine? And that's just a false dichotomy. So that's the shift.
I mean, there are obviously parallel kind of, nomenclatures and words going on here. But I mean, I think, within the group of non-problematic drinkers with inverted commas and everything else, there are people who I suspect who are suffering ill effects from drinking that they're simply not aware of. Maybe the anxiety effects or the depression or memory problems, particularly in older generations, who simply from a factual perspective could be told, listen, if you drank less, you would sleep better, maybe have a better memory, feel a little bit more chipper in the morning. Things that do people report quite often in these sober sprints. But I mean, these are sort of scientific facts that these levels of drinking have measurable effects on people. And is there not a danger we missed an opportunity to tell people that information?
Yeah, I just think we've got to be careful about the expectation that education works, because, people, I think even Janet said, she was quite rebellious, that people react rebelliously to a lot of health communication messages because they know that for them, maybe they know that on some level there's a risk, but they choose to do it because, alcohol makes them feel good in the moment. And I suppose the thing that I would always counter is, the assumption that people just need more information. People are, we can't shy away from the fact that people like to drink alcohol and it's culturally embedded and that it does have positives and benefits. I'm not saying that we should try and convince people who have an alcohol problem that they need moderation because there's benefits. I'm saying in the broader population, we need to account for the reasons why people drink when we try and communicate these messages. So, that's why the recommended guidelines don't work, essentially. There is low awareness of them, but even people who are aware of them and drink heavily say they're nonsense consistently, not because they, don't think the evidence is, they don't want to disrupt their kind of.
But those same people may also be going to the doctor and saying I'm depressed, or I'm going to the doctor and saying I have, trouble controlling, my mood, or whatever, or turning up at A&E, and the same people are actually suffering harm as a result of their drinking behaviour, and maybe not drawing the connections between the two. But it's
one of the sorry. I think that one of the problems with the approach of saying it's promoting abstinence is if someone is fundamentally not interested in abstinence, they're fundamentally not interested in stopping drinking. If you're promoting that as this kind of gold standard approach to intervene, they're not going to engage with it because they're not interested. So actually what you do in that way is missing a whole bunch of people. And I don't think anyone's saying that you shouldn't communicate the risks of drinking. You should almost certainly communicate the risks of drinking, but you can also promote the idea that there's this dose response we know with alcohol. The more you drink, the more harms you experience. Any reduction is positive. And actually, you've got to be pragmatic and realistic in order to get people to change their behaviour. And for some people, stopping drinking isn't desirable or realistic. So you actually, I think, missing more people by having this kind of abstinence only or there's no point approach.
Well, I suppose the people who wrote the guidelines basically had, that in mind, in the sense that nobody's really recommending people drink nothing. They're saying drink relatively little, but nobody's paying any attention to what we can tell. Can anybody else want to come in? Maybe Janet.
Tracy.
Tracy, do you have your? Sorry, my setup here means I can't see. There we go.
I actually, when you were talking about public health, I just wondered if the mental health, and you kind of touched on that, Phil. I wondered if the mental health was something that was being spoken about. That is, in fact, why I got curious and I moderated, and then I said, "Oh, I just need to stop," and it has really helped my mental health. And so I didn't know if that's a part of the conversation in the world.
Well, I certainly think it would be. You're in the US.
Yes.
I understand. I mean, I think for the most part in the UK, or Janet's there in South Africa. But I mean, that is sort of part of the debate, but not central to it. In the US, are people kind of bringing this the alcohol issue into the growing awareness of mental health problems, or is it still just a bit of a skeleton in the cupboard?
I feel like it's a little bit of a skeleton in the cupboard, but it's absolute truth. So I hope more people sort of speak to that. I know Janet spoke about guilt in a lot of her clients, and I feel like that's a big part of it. I don't know, especially for women. I'm not sure about for men, but that's something I'm just curious about, if that's, like I said, a big part of the conversation, or if people go to their doctors and get prescribed over the counter, drugs, and then think everything's fine. I have this antidepressant, so I'll continue drinking. So, which is what I did for a very long time. Like, oh, I've got this, so
have another drug. Yeah. Janet, are many of your clients, struggling with mental health issues? Is that one of the reasons?
Yeah, what's quite interesting, Phil, is that I get a lot of people that are in therapy, and they've been in therapy for years, for anxiety, depression, and then they come along and decide to do something about their drinking. And when they give up drinking, when they succeed, they feel so much better, like Tracy, and the anxiety is just gone and the depression's gone. And, but the therapist that they've been seeing never mentions alcohol. They just work on these deep issues, and nobody, I'm sure some therapists do, but a lot of therapists, they don't go there. It's like, the elephant in the room. So I think that's important, that therapists start just, noting people's drinking behavior and seeing if there's any link.
People seem to, as far as I understand it, so people who work in that area are fearful of touching on that. And I think I had a conversation with somebody on LinkedIn who I think he was Greek, but I think this is a global problem, which is why this platform's so good. But basically, he said something like 3 out of 5 of his clients had some issue with alcohol, but it was not, sort of part of his job to deal with it. So maybe James has got something to say about that. He's obviously a little bit of his own experience, but obviously the research as well.
Yeah, I mean certainly from a UK perspective, the missed links between mental health and addiction issues is just a long-running, really frustrating problem, certainly from a service perspective, where mental health services have said, oh, we can't work until you've addressed your substance problem, and vice versa. But, it's so frustrating because we know that they're just, in many cases, they're one of the same thing, that, the sort of empirical literature does show that negative emotionality, underlying psychological issues or problems are the biggest predictor of dependence issues with drugs or alcohol. So, I think a lot of, I'm really interested in kind of mental health literature and the conceptualization of mental health problems. And, I'm quite critical of both alcohol-related or alcohol problem and mental health problem diagnoses, where the implication is, it's a kind of medical or biological problem in which drugs are needed to kind of address that, because I think, you know, alcohol addiction, mental health problems are just problems of living, and drugs might be an effective kind of short-term way to cope or manage or dull kind of problematic feelings. But in a broader sense, you know, alcohol use or experiencing low mood or anxiety or even hallucinations, they're kind of normal, almost normal coping mechanisms to difficult life experiences. And I think, yeah, any good drug, alcohol or mental health therapeutic intervention would never separate, would always just take a very open-minded, formulation-based approach to working out how all of those different things fit within that person's life and helping them to make sense of them and work out what their best route to recovery is.
But so the reality is that people don't generally get mental health treatment until they've, in many instances, until they've had addiction therapy. At least in that's.
Well, a lot of mental health roles won't feel confident to work with someone who has a serious addiction issue or a heavy drinking problem, and because, you know, alcohol, you know, does obviously create, you know, things like high anxiety or other problems or cognitive functioning problems, that, you know, obviously it can be problematic in a specific mental health treatment. But that's what I'm saying. We, you know, you know, the kind of idea that you could separately treat mental health or addiction, I think is a kind of another false binary, in the sense that very rarely, if ever, the two could be genuinely separated if you take kind of less diagnostic view of these things.
Yeah, I mean, I think the conversation, as the phrase it goes these days, is that, you know, the mental health issues are kind of normalized. You know, I don't think there's many. My light is flickering on and off in this rather strange and frightening way. Yeah, there are not many celebrities who haven't sort of, you know, talked about their mental health issues. It's become sort of part of the conversation, you know, on social media and so forth, and in some ways become less serious. You know, to say that you've had mental health issues is not something which is sort of a catastrophic, you know, thing to say these days. And I wonder whether, you know, somehow, while acknowledging the fact that obviously alcohol problems are very serious, they're also extremely common. It's not a rarity, and it's not something that necessarily people should necessarily hide in the way they have in the past.
In the UK and especially in London right now, it's funding. I work closely with CGL in central London, and they have a specific alcohol. It's rather than alcohol and drugs, so we know it's the same thing, but that's what it's called, the alcohol service. I've got clients not in a bad place, in an okay place, but want to reduce, want to look at moderation, and they've got some mental health problems as well. Been waiting for one client's had one appointment in 4 months. In that appointment, she was suggested that she should visit museums to help her health. And doctors aren't allowed to prescribe anything that reduces cravings. They have to go through the drug and alcohol services right now, and it's an absolute. It's just funding is just, and we're about to have another round of cuts, I believe. James, you probably know about that, but we're about to have another. I think probably about 8 to 10% of cuts. It's just dreadful, absolutely dreadful.
From your perspective, how would it work? How should it work? Should there be like one person who deals?
It should be back in the NHS.
Right.
Right, so it's not funded by the NHS, so the medical staff are paid for by the NHS, but the drug and alcohol service providers are funded under councils, right, since 2012, I believe, and they're funded, and it's in what's called the social care package, and their funding has been reduced by 40 to 50% since 2012, and we're about to have another massive round of cuts. I mean, just huge draconian, because councils have to save money.
Isn't it beyond that the fact that people just sort of it's sort of an institutional thing? It's that, you know, that this is my job, that's your job, and people don't want to, you know.
Well,
so no matter how it's funded, people are just going to say, well, I can't deal with this until you've dealt with that. You know.
The two, mental health and alcohol services are supposed to work together, and some do, right? But it's hard because, as James says, the thing that happens is someone goes in and they're in a bad state, so they're told, we can't send you to mental health till you've given up drinking because you're in addiction. You can't have any therapy till you've got over the addiction. How about reducing? So if you reduce a bit, a client of mine was given a mug, a mug, okay, with some little marks on it. That was at the beginning of December, right?
So the idea being to drink their sort of tot of rum a day and no more sort of thing.
Yeah,
right.
Yeah, a mug. Sorry. And it's a mess. I think post-pandemic there'll be a huge backlash. But we had a budget earlier this week where we didn't increase the tax on alcohol.
So can I ask just a question? What you know? Obviously, part of the problem is the fact that you know, there is this reluctance to talk about this problem, or to identify, as people have put it, with this problem. What messages, what things that would make people say, I know this is something which, you know, I am prepared to come forward and address, or maybe address privately, without this sort of feeling that they're sort of admitting to some horrendous flaw in their characters.
Well, most people that come to see us are in their middle 30s, which is really, and it's staggering, and mainly men. The girls, there's a reason why a lot of girls don't come to groups, is because of their children. Because if they say that they might have a problem, their children might be taken away from them at that age. I'm with Janet and I'm with James that I believe that after about 55, though I'm in my 60s, it's really hard work. It's really, really hard work to give up, because you have to work so much harder. So, and the people, I find that everyone's quite happy to come and talk and see and help each other, and I'm really quite amazed. I think there's a backlash. I think a lot of young people don't drink as much as well.
And alcohol-free drinks, they're just going through the roof.
Going through the absolute roof, right? And you know, when I started 5 years ago, people go, "Why don't you drink? Are you one of those alcoholics?" And incidentally, the word alcoholic is not in the medical definition, as it's not in the US definition of it's alcohol use disorder or whatever. I don't like the label, but then I'm not an AA person. Sorry. But yeah, I think a lot of health awareness, right? And you know, the trouble is, the people who come to see people like Janet, myself, or talking to James, Melissa, Tracy, are reasonably educated. They're looking at their lifestyle. They're realizing they're getting a bit messy. They're realizing that this isn't quite what they signed up for, right? They're not students anymore. But they're all working. They've mainly got good jobs. It's because their partners recommended, and it's too much binging. They've been to hospital too many times. The people that I don't engage with at all is people whose lives are not going to be improved by giving up. You know, I mean, if you've got a pretty shit life, you might as well drink. You know, if that makes sense.
Yeah, I mean, if you don't mind me saying, your age group is one which is of particular concern. I think the younger age group, at least statistically, not to deny there are problems, but at least statistically, are lower. What, you know, of the people who are approaching you for help, of the older age group, I mean, what is it that motivates?
An absolute struggle.
Right.
Mainly because their drinking is out of control. And they're on the fringe. They're looking at probably between 50 to 100 units, and they're about to really escalate very fast up from that a week, which is, and they're amazed, absolutely amazed when I say 14 units. They go, oh, what, per night? I go, no, per week. As Janet said.
So you would, for in an instance like that, what do you suggest to them? I mean, presumably if they reject 14 units, the idea of 0 is out the window. But what
it has
do you
to be
suggest?
0 at that point over in a certain age group. I think it has to be 0. I
Mm.
really do, because I think there's too much social conditioning, too much brain pathways and stuff. And I'm totally with James, is that if you can have at least 6 months sober, then make some choices. But what I say to people, and I'm sure that other people do, I say, never look at it. We don't do day ones or anything like that. We don't bother with that. I said, don't look at it as the bigger picture. Look at it as a small picture. Look at it as 2 or 3 days. Look at it as a week. Look at it as 1 day at a time. Look at it as, well, why don't I try this for 2 or 3 months? And especially for the younger people who don't ever say would never again, unless there's been a big problem, a big health problem where they will die if they drink again, you know.
Mm-hmm. I think the thing that came that surprised me, and in a way still surprising me, just how long it takes, is that you know, to get rid of mental,
1 year to 2 years.
Yeah, exactly.
Sure.
And I think that people would like to think that, you know, a bit of an effort for a month or a bit of an effort for a few weeks and then they're done. And that's probably the hardest bit, but it's a long, arduous and lengthy process. How do you kind of ready people for such a?
Don't tell them. Much easier. Don't tell them all sorts of stuff. Don't tell them about pause, which is post-acute withdrawal symptom that kicks in about 6 months. No, why bother? No, seriously, I was joking. I say things like, there is no magic button. I say things like, have you bought the book that I told you? They go, yes. And I go, well, have you read it? They go, oh. And I go, you have to work. You have to work at this. Don't think that you can come to a meeting and you're going to go away. Janet seems to be working with the same sort of people as myself, is you had to keep it quite amusing, quite light-hearted, quite good fun, right? You've got to keep it going. You've got to make it, it's not hell. If it's hell, you won't do it. And that's why I'm so anti a certain other method, is don't beat yourself up. Look at the good points, look at having a decent quality of life, but it doesn't involve your drug of choice. But those who are really struggling, they'll be back, right? If they're 35, they'll give it a go. I lost 2 girls this week. I haven't seen them for a couple of weeks. They were just miserable, just so miserable. But 6 months down the line, they'll be back because we've sown the seeds, right? There's no day one. It's constantly building, constantly telling yourself. And luckily in the UK, there's so many club sodas doing this, but there's so many people not drinking. Right, it's not social stigma anymore. Right.
Okay.
Yeah.
I'm going to
that's a huge step forward, isn't it?
Yeah.
Sorry, Jenny, you carry on. I was actually just asking.
Yeah, I was just saying, if there can be a cultural shift, you know, so that we don't feel like outcasts because we don't drink, you know, that's huge. But we have a lot of success with challenges. You know, because people don't get so stressed thinking, oh, I can have a drink again. We do something called Sober Spring, you know, which goes on for 66 days, because allegedly you can build a new neural pathway in 66 days. So that we get lots of people signing up for that. And what's interesting is that many of them, I won't say, you know, most of them, but many of them at the end of their 66 days, they feel better, you know, and they've got more mental clarity, they feel fitter, and they decide just to carry on a little bit longer. So then they do 100 days.
So it sounds like it was like a savings scheme, you know, sort of a Christmas savings scheme. You're sort of going up, you know, 1 week at a time and building towards something greater. Has anybody got any more questions or points they'd like to make on that issue of how, you know, how we might address this problem in, sorry, my light flickering terribly. If we're looking at ways to address these problems, then, you know, we have to make it a choice. And I think maybe one thing is that if we've given up and we're sort of in a position where we're able to, you know, sustain and enjoy our lives while giving up, then the idea to restart drinking is a genuine choice, as opposed to if you're you know, having a dreadful time while not drinking, then to restart is no, it's a kind of coerced choice. So what you're doing actually creates a space for people to be in a sustainable period of non-drinking, and then if they do return to drinking, it's a choice made from a position of comfort, in a sense.
Yeah, I wouldn't dare.
I wouldn't dare. Too much to lose.
I don't have another recovery in me.
No.
I'm done with all that shit.
Done. But then I totally understand, you know, James's way.
He's young.
He's younger, right? And I'm curious, but you know, the thing is, when you work with people and you see people all the time, you hear stories, you think, I'm not going there. I'm just not going there. And my recovery has been based on hearing other people's stories, by working with people all the time. And I've heard some pretty grim stories, and people of our age, you know, I'm in my 60s, not worth it.
Yeah, no, stories are so powerful.
Really,
you know, I'm doing a podcast now with just sharing stories, and it's amazing. And people are brave, you know, they come out and they talk about what they've been through, and other people listen and they think, oh God, I'll be there if I'm not careful.
Yeah, I do that as well. I do point out some of the younger people about some of the older people, and I go, but I think one of the things we're all trying to do is take the shame and stigma away from drinking. So I equate it with diabetes, with having a cancer. I bring family members in where possible. I try to educate the family members so they know that by the time you're in addiction, this is a problem, right? It's not shameful. You can't just put the drink down. If you wanted to put the drink down, you wouldn't be in this group for addictive behaviors.
I think there is a common element between you and Janet, which is you're female, obviously. And I wonder whether James might have, from my experience of being a guy, that we don't actually necessarily share stories and really necessarily form communities in quite the same way. I just wondered whether there's maybe a different approach to this topic, which might appeal to the possibly slightly less sociable male.
Yeah, community is everything in this journey. We do have a few guys, but to be honest, it's mostly
all
women.
Guys. I'm all men, right?
Can I just ask James for his response from the male perspective, and then we'll come back.
Yeah, I mean, there's definitely gendered aspects to drinking. I mean, men do, even though the big rise in consumption, you know, over the last 50 years has been women catching up with men, or closing the gap a bit more. It's still, you know, men that kind of the heaviest drinkers, but not to, of course, minimize the issues facing women at all. But yeah, I think, you know, just sharing stories, I totally agree with that. And I think, you know, it's not just me as a young person that can benefit from cutting down their drinking or moderating. You know, the Adrian Charles story, I think, is a really powerful story, because, you know, I don't think many people would watch the Adrian Charles documentary or talk to him and say, no, he's kidding himself. He needs abstinence. He's cut down. And I think he, you know, cut down from roughly 80 units to, I think he says most recently that he maybe drinks, not within the guidelines, but 20 or 30 units a week or something like that. So he's more than halved his consumption from a level that, you know, where, you know, 10 unit reduction at 80 units a week, it has a much greater health gain than 10 unit reduction from 30 to 20. So I think, yeah, like, and I've still got lots of friends that I've made who don't know me long enough. But again, the point that Melissa was making is, you know, I know people, you know, I play golf. That's one of my kind of vices or kind of escape things. But there's guys at the golf club where drinking is such a part of their identities and their lifestyles. And some of them are very heavy drinkers and some of them less so. But I can't see any of them, you know, joining an online community, you know, not to undermine it, but join an online community or doing yoga or, you know, kind of a lot of the things we associate with positive sobriety. And that's not to knock those things. It's just to say they're their identities are so far removed from that. But, you know, sometimes they do say, oh God, I wish I'd drank a bit less, or I do need to cut down a bit. So,
Yeah.
Again, I think,
Well, I think, James, in the UK, 1 year no beer, I think they're very good for the guys. We often send people there.
yeah, that's
You know, they've got more of a sporty and you know, they're
Yeah.
young men running it. They used to be
Absolutely.
traders, I think.
There's something that Adrian, I listened to the podcast just before, I'll refresh my memory of the podcast, and something that came up in that was from Adrian was saying basically that he looks at it from a quite a sort of positive perspective, saying, you know, line up all your drinks and just imagine how many of those are actually, you know, sort of positive drink, you know, something which you actually genuinely value, and how many of them you just kind of woke up the next morning regretted having had them. And he was basically saying that he thought, you know, a third of his enormous, consumption was the positive. You know, I think that, you know, that sort of rationale has some resonance with me, at least. I don't know whether it's necessarily a male perspective, but just trying to look at it as a, you know, a nut to crack kind of thing. I don't know whether there's something in that.
Yeah, less is more in so many things, but of course, abstinence is better than less if you can't achieve less.
Yeah, and I think the other thing which I suppose I would slightly, you know, obviously I'm not you're not here to answer for Adrian's perspective, but you know, he mentioned that he was talking about how it offers a kind of comfort from you know, a hard day or a bad mood or whatever, and that's sort of a borderline that's very difficult to tread, isn't it? You know, obviously, when is it you know, a comfort in the sense of, you know, a nice bit of music or a, you know, warming fire or something like that, and when does it slip into, you know, self-medication? I just wondered whether there's any real way to determine that.
No, but that's kind of at the crux of the issue that I think I was trying to kind of say in my opening gambit, that if you're using alcohol or any drugs or any behavior because, you know, you want it to make you feel completely different, you know, you're trying to use it as a way of changing how you fundamentally feel, that's not always associated with addiction or problems, but it's not a good sign of being able to moderate something. So yeah, the controversial thing that Adrian said that some people have fed back about that podcast was, he says alcohol is living in the moment. Well, I mean, it is if you define living in the moment as doing what you want to do and you want to drink. But from a kind of Buddhist or mindfulness perspective, it's the opposite of living in the moment. And, you know, I try and meditate and do yoga because I think that's much better for me in terms of managing anxiety than having a drink. I mean, and having a drink might, you know, dull your anxiety very effectively for that moment, but it's a bit like taking a drug to, you know, I don't know, I see it as a bit similar to kind of medications for depression, that you're kind of more dulling the experience rather than addressing it at its roots. So yeah, I think for me, I continue and always continue to question, you know, why do I really drink? Is it because I like the taste and, you know, whatever, or is it because it does give me that mildly pleasurable feeling? But I strongly do believe that if I go through a difficult phase in my life, which I may well do in the future, and, you know, lockdown's not been easy for me, I'll, you know, be honest, that is a time to really be careful and drink less even, because, or nothing at all, because, you know, I think I always will be at risk of, you know, wanting to drink more if my mental health would to kind of suffer more. So I think, again, we see, you know, recovery is a lifelong process. I don't think it's ever something where you just say, oh, I've recovered and I'll always be abstinent or I'll always be able to maintain moderate drinking. It's just a part of, you know, managing the trials and tribulations of life. So
yeah, I mean, one of those things there, which I think is perhaps slightly different from men and women, is the extent to which men are expected to control their emotions, to be sort of tough and able to take anything, and not really acknowledge the emotional life. To, you know, if you take it to a sort of very stoical kind of Victorian approach to being a guy, which I think is a difference in the way that we are expected to deal with this. And I think from you know, just from a genuine, alcohol offers a solution to that, to achieving that that goal, if that is your goal, to, you know, get through a difficult 24 hours without seemingly acknowledging the misery that has befallen you. It's not a bad solution, but it backfires for a variety of reasons. So
yeah, I'd agree. Toxic masculinity is, I think, been labelled this idea, you know, like boys don't cry and that kind of stuff. And yeah, I definitely think that sort of was partly rooted in some of my issues, that as, you know, I wasn't able to really express difficult emotions or feelings, and they became bottled up, and then alcohol was a way of feeling like I was releasing them. And I definitely think the idea that men, the pressures on men not to draw on social groups in the same perhaps way that, you know, to express feelings and emotions and be sad. You know, I sometimes feel like I want to cry, and it's a very difficult thing to do, especially in front of other people. And I'm not saying it's easy for anybody, but I do think part of that is a bit because I'm a bloke and I was brought up.
I think for a lot of, I mean, maybe slightly different ages, but I think there are the emotional life of men is sometimes almost seen as an abnormal thing. You know, as a man who has emotions, or at least talks about them, is somebody who sort of is transgressive in some way. And alcohol is, as I say, this kind of veneer that you can overlay in your life, and overcoming that is a genuine problem, not just for alcohol consumption, and maybe a little bit beyond the remit of this this little seminar. Has anybody got any point they'd like to make? Because we're drawing towards a close. If you'd like to raise a hand and pose a question or raise an issue, then please do so.